So as there are some people here who don't really know me, I'm going to introduce myself as well as Shig. So I'm a relationship coach, and I have a special interest in people who've experienced abandonment or separation trauma as children. This is mostly partly because that was my experience, having gone to boarding school. I worked for 20 years as an osteopath until last May, and I spent 15 of those years working with people with chronic fatigue syndrome, or ME, as it's often known. And during those years, I've recognized the role of childhood trauma in chronic illness. And then started to realize that my own relationship history, which has been pretty terrible, reflected the trauma of being sent to boarding school at the age of 11. My first big step, I had a lot of counseling, but my first big step into healing really was when I came across the 3 principles, which is something that Shig and I both have an interest in. And my second step really was meeting my current partner, and where I was able to experience safety in this and to be able to practice relational mindfulness, which is quite a new concept for me, really, and to become present to my own destructive patterns, which leads to healing. So that's me. So Shig Hayre, who I think I met you about maybe a couple of years ago, Shig. I'm not sure, to be honest. But oh, Shig, I have muted you. Do you want to unmute yourself?
There we go. Is that better?
Yeah, thank you. So yeah, Shig is, and 20 years ago, Shig was an international entrepreneur operating in the UK and the USA. And he worked relentlessly and grew his business to a point where he was really wealthy. But at the same time, his alcohol consumption grew alongside the business. And it kind of started as a daily coping mechanism and then turned into an addiction. And eventually you were diagnosed with Wernicke-Korsakoff syndrome, weren't you?
That's right,
Which
yes.
is apparently, I never knew this before, but apparently known colloquially as a wet brain.
It's classed as a wet brain in the alcoholic term, yeah.
Okay.
They call it a wet brain, yeah.
So then you went and got some very specialist medical and psychological help in the USA.
I did.
Got dry, and you've been dry, is it 18 or 17 years?
It'll be 18 years in January, so I'm still coming through my 17 years, one day at a time. So, and that's what I do.
And so you're much healthier, obviously, and you're happier, and you have a way better quality of life.
Oh, fantastic!
Yeah.
Totally.
And so, as a result of this, you're obviously inspired to set up SP Bespoke, your company. I guess along similar lines to what you received at the USA, but I think you've expanded how the process works. And I'm going to hand over to you to talk about what you actually do with your clients. But I think what's really important here is that Shig has shared the same experiences as his clients. So you've experienced what they're experiencing. So you have a much deeper understanding of it than somebody who's never been an addict.
Well, the thing, with this sharing the stories is that you've got to show empathy to anybody who you're working with, and and when they realise that you're being through the same kind of issues as they have, you're working on a level where they know that you walked in their shoes as well, and it builds that trust very quickly, And the treatment that I had over in California was based on setting this business up as well, in a sense. But this has been, we've expanded it in a sense that we bring in legal work and business work, and that's the key to this, But as you know, with any illness, especially when it comes to alcohol and drugs, there's a certain amount of legal stuff that comes into your life, whether it be disciplinary at work, or whether it be divorce pending, child access, relationship problems, all these kind of things happen. And, so there's a legal requirement there that we need to help our clients with.
So it's a really holistic approach, isn't it?
A very, very holistic, complete wraparound service. And, it's, we're not doing anything different to what we did 5 years ago when we set it up. The only thing we've got is more and more team members, more and more people on board with us who can help people. But the concept is exactly the same as it first started. That was a complete wraparound service, right from the legal issues, like I say, all the way through to the addiction, all the way through to the family, which is so important, then onto the business side of things as well, because a lot of our clients seem to be self-employed or have little businesses of their own. And again, my story is, number one, I should have had some legal analysis done for me and some help on the legal side, which might have helped me in my early days with my businesses and my family.
Yeah.
And definitely on the business side, because I was spending money that I shouldn't really be spending, because when you're not, on top of it, you spend more money and you're wasting money and you're throwing money away. So all these kind of things are affected by my drinking.
Yeah. So it sounds almost like you kind of got yourself into a vicious loop there.
Yeah, because the thing is, again, I don't call any organisations, but I don't know many organisations where you could, residential anyway, where you go into and you come back out and all your legal stuff is being sorted while you're in there. I don't know many organisations where you come out and your business is still there and it's still running in a fashion, but it's still there and needs to be sort of reassessed and run properly. And so I don't know many organisations that do that, but that's what we do. So we really,
sorry, Shig, what you're saying is that when you work with your clients, you keep their business running so that when they come back,
well, what we do is when we're working with our clients, we look, if they want us to, 9 times out of 10 they do, is to look at the business and see what's going on, because anybody who's been drinking or taking drugs and are not really with it, even though they're functioning, their businesses are taking a bit of a whack on this, because I know mine were. I was employing more people than I needed to take my place, if you like. So I didn't have to be there. So there's lots and lots of things that happen in businesses. So all this is done on the outside. Nobody sees that work being done, even the lawyer side. So, once we've sorted out what kind of legal issues they have, disciplinary at work or divorce pending or child access or anything like that, or they need mediation. A lot of it, the mediation is done in front of them, but all the rest is done out in our office, out of the way. And the business side of it is done in the business side. There's no need to come into the home to do that.
Okay. Can you talk a bit about, because I know in our previous conversations you told me that you deal with the addiction first and then you deal with the underlying causes of the addiction.
Yeah.
Can you talk a bit more about that? And also how that relates to the family, because I know you're working with the rest of the
Yeah, I mean, the reason we set this up is mainly it's family orientated, is to get the whole family involved, because the one thing that I found that was missing was the family.
Yeah.
Because it's a ripple effect. It's like throwing a stone in a pond and watching this ripple effect, and it affects so many people around you. Your loved ones and your family, your children, breakups with relationships and things like that. And again, my history, tells that same story. And so it's a matter of sort of saying, well, look, let's get the whole family well, because when people come back from a rehabilitation centre, even though they've had some work done on them, the family, it's not the same. Everything's there. They're being used to, enabling. They've been used to so much codependency. They've been used to emotional blackmail. There's so much that goes on with families. They've stopped talking to each other, and they're upset each other, and so our job is to go in there and not just help the primary sufferer, but to help the family as well, to understand the illness, understand why they've been acting out the way they've been acting out, and let them get a good understanding of why, what this illness is about. And it makes so much sense to do that.
It sounds like also you see them interacting with each other. So you're seeing them interacting with their family.
Yeah.
Whereas if they were in a residential rehab, you wouldn't see any of that because they wouldn't be with their family, would they?
Yeah, I mean, look, residential rehabs have their place. There are some people that we can't help. There are some people that need to go into residential, So I don't really like to call any places and say they're not as good as us or better than us. All I can do is say that we set this business up. This is the way we run this, and it's an alternative to a residential rehab, because over the years and over so many years, the only thing people had were residential rehabs, and it's changing that structure to sort of for people to think, hold on, it doesn't have to be that way. And so, and why do we work on the addiction first? Because you're not going to get any sense out of anybody who's drinking or taking drugs to a point where you want to discuss why they're drinking or taking drugs. We've got to get them off the drinking drugs first and foremost in order for them to start thinking clearly, where we can start working with them.
And are there specific patterns that you notice in terms of the underlying causes of the addiction?
There's always specific, and I can tell you now that there's not many cases that I've done where somewhere along the line it starts at childhood, and works its way up. And I'm not saying that I didn't have a drink when I was a child. That the traits were there. That's something that I just didn't quite fit in, or I was. I don't know. There was something not right with me, which made me different to other people, I think. And I say that because, I think I internalized everything.
Yeah.
I've got two sisters and a brother who are not alcoholic, are not drug addicts, or never been, and yet they went through the same, problems that I had as a child. And there was a lot of bullying and racism back in them days. I'm 63 years old. So, there's abuse in the family. And so everybody sort of went through the same thing as I did. And then I ended up being the alcoholic in the family. So I tend not to blame all that stuff. I sort of tend to look at it and sort of say, well, they knew how to handle life better than I did.
It is about how we handle it, isn't it? Because we respond to our specific circumstances with a sort of like coping strategy or something. And for some people, that's, you're not the first person I've met who realized that they could manage their, I don't know, I'm thinking of managing those difficult feelings by drinking, because it
and needing to have a drink every day without even though you don't want it. And that's a problem when it becomes a problem. Because I wasn't like that in my early days at all. I could drink like everybody else, or I thought I could drink like everybody, but it became progressive as it went along. But I did find the medicine of choice that seemed to calm me down, did find the medicine of choice that seemed to switch that roundabout off in my head, and that, looking for an exit sign. So in a sense, I was just burying everything over the years, to be honest with you.
Sure.
And then collateral damage starts happening.
Yes.
And, you don't realise that it's happening around you. And, it cost me everything. It cost me my marriage. It cost me my oldest daughter. I've not seen for 30 years. I got done for drink driving 3 times. It goes on and on and on, but I was so dependent on the alcohol. That was the last thing that I was going to let go. That's the only thing that I ran to every time I had a problem.
So it was the one thing you wouldn't let go of.
And it cost me dearly. Cost me very dearly. So, and I don't like that word rock bottom anymore. And I don't like the word we're not ready yet, because this is the only illness that I know that family members will watch somebody else suffer a little bit more before they'll step in and say, right, we better help them. There's nothing else I can see out there, where, if you got heart problems or if you got anything else going on, they don't just say, oh, well, let's wait till you have a heart attack and then we'll sort you out.
That would never
but with alcohol, it's always they're not ready yet. And I think to myself, okay, so when are they going to be ready? Is it when they lose their self-respect, their dignity, their finances, their marriage, their relationships, their jobs? Is that when they're ready? Well, it didn't work for me, and so I personally believe we can get off that ladder with the right help.
Yeah, absolutely.
That's what I believe. And I believe that if you're not that bad, and if you've not lost your wife, or you're not lost your husband, or you're not lost your child, or relationships, or your job, I believe you can step in there, because the quicker we can get them well, the better.
Of course.
The trouble with collateral damage is once you get collateral damage, we have to start working on the collateral damage. So I had to have work done on me with my daughter, with my relationship, with my marriage, with my businesses. There's a hell of a lot of work had to be done on me.
So there was a lot more work to be done.
Yeah. Whereby we can get in there quickly, and we have done that quite a few times.
Yeah.
It works.
And so you've got much more focus then on the actual addiction, because you haven't got to deal with all the collateral damage.
And secondly, as well, the word addiction, I'm not sure I really like that word addiction much. I prefer dependency, because isn't it, you know, not everybody is addicted, you know, and we've come across clients who have had a bereavement in a family, you know, or something major's happened in the family where they've drank on that particular issue. It doesn't mean that for them they are addicted for life and they can never drink again. So there's difference in people who, you know, the reasons why they drink, and can they drink sociably again, or like myself, I can never, you know, pick up a drink again.
Yeah. And that has, when you say dependency, that's not so far down the road, is it? Is that
No, it's not, and it will get worse. It gets progressively worse. And now I'm not saying that hopefully, well, before all this happened, I might have got help, or I might have been. I don't know the answer to that question, but I do know that we've helped people who have not lost anything at all, but it's been problematic with their relationships, and it's been problematic with their health. To sort of say, I'm doing this, and I really want to knock it on the head now.
Which is brilliant.
Yeah, which is brilliant. You know.
Shig, can you talk a bit about the way you work with the underlying causes, the trauma, whatever it was from childhood, and how the three principles comes into that, maybe?
Well, look, when you look at any addiction or any dependency, there's an underlying issues about them. Nobody's just drinking to a point where they're just drinking for the hell of it, or taking drugs for the hell of it. There's a reason behind all this. So, you know, we've got experts in every single field. You know, sexual abuse, domestic abuse, child abuse, you know, PTSD, attachment, abandonment, you know, ADHD, autism, you name it, we've got them, and we need them people, because there's so many issues that are going on within that family. And it's not just the person that's the primary sufferer, it's their family as well that can have some issues going on. So our job is to go in there and repair the whole family and look at the whole family dynamics of this. You know, but but our experts, they're brilliant. They're the ones that are brilliant, not me.
Yeah.
They're the ones that know their job, not me. You know, they really, we call them in on each specific issue.
Yeah, and there's a long list of books on your website, I've seen.
Yeah, so, you know, it's not like we, because we don't live with our clients, we stay in hotels locally and we're on call 24 hours a day. We don't just bombard them with counsellors neither. You know, there's two people that will go in every day, and we will swap and change them people as and when we need them. So number one, obviously, we've got to get them off the drink of the drugs. And number two, then we start working with the issues. And depending on how many issues they've got, will depend on how many team members we have to bring in for that particular week. But there will always only be two people there.
Oh, okay.
In the house.
In the house with them, but there might be other people coming in on other days.
Yeah. So it's only ever going to be two, because otherwise it's too much and it gets overwhelming. And then two people, their job is to work with both the family and the primary sufferer.
Yeah.
So we encourage, you know, the children, and we encourage the brothers, the sisters, parents to be there as much as we can, so we can help them.
So you're bringing members of the family who might not live in the same home, but
they come down, and even if they spend a few hours with us at a time, or you know, or come in and see us for a day, we love it, because we can then start wrapping our arms around the whole family, not just the individuals.
And actually, somebody's just travelled a long way, like if they say come from Scotland down to the south of England, it's showing a degree of commitment to that person's recovery.
Well, we don't actually. We number one, we go to them. They don't come to us.
What is it?
But the team members, team members, we will bring them in. We've flown them in before from to Scotland. Of course they'll have the commitment, but you know, all our team are committed. All our team.
What I meant was it's family members showing their commitment. Like if there's somebody.
Totally. Sorry, I see where you're coming from. Yeah, and totally get you on that. Totally get you on that as well. Yeah, it does show that. And to be honest with you, once they start learning about this illness and educating them about what's actually going on and why they're drinking too much and the reasons why they're drinking too much, it's amazing to see this light bulb come on with the whole family. It really is. You know, I know what it's like to get well and then have to go home and face up to my family, and it's not very nice. You've literally destroyed that family. You know, you've broken them apart. You know, and I wish I'd have had something like this when I was getting well. So my whole family could have got well. You know, luckily for me, yes, we've got family well now, but it took time. It took a lot of time because there was no one to explain to them.
Yeah, so this is about repairing the relationships within the family, isn't it? As the person heals.
The thing is, Sorrow, you know, the family are ill. They're depressed. You know, they're anxious. They've got their own problems now because of your problems building up on their part, financial issues. It goes on and on and on. You know, they have to face up to this.
Yeah.
And it's heartbreaking to see it. It's heartbreaking. So we try and sort of say, look, and the difference between our service and most other services, we do all our work within 7 to 21 days as well. So we're very, very efficient and quick at this. So rapid recovery.
Yeah.
And because we're spending so much time with them. You know, and that's another difference between us, I believe, and the residential rehabs. It's all one-to-one. We're not working with a bunch of other people.
Well, there's no group work.
Yeah, we're just working constantly without one person and their family.
Yeah.
So we're putting all our time and effort in there, you know. And then when we finish, we give them free aftercare for the whole family.
Yeah.
Not just for the primary supper, but for the family.
And I think you said that goes on for as long as they need it. Is that right?
That goes on for as long as they need. There's never you know, we encourage them to keep in touch with us. The family can see things that we can't see. You know, they can see if they're not, you know, themselves that day, or there's something happened, the pup's lost their job or anything like that. You know, the family can see it. And so they can call us and we can put it right. We've never charged a client twice in the 5 years we've been in business. Never.
Which is an amazing.
So once they're paid us, we never ever have charged them again. And that's one of our things that we won't do. Yeah. We're not a revolving door. It's a big statement to put out there, get well and stay well.
It is.
And the stay well is down to the clients. You know, we would giving you everything we can give you. We're giving you all the tools, we're giving the family the tools. You know, you've got no excuses. You know, you can pick the phone up, you can call us, you've got all the paperwork that we've put there. We've left everything there for you, you know, and we've got you in a position now where you're doing really well. And we advise a lot of them to go on and get some more extra counselling anyway. Because you'll need that, depending on what their issues are. But they've always got us there as well. How
often do they actually, what's the word for it? I want to use the word recidivism, but that's wrong because that's for criminals. Relapse. How often do they relapse? I mean,
well, we're very lucky because we've only got a 3% relapse rate.
3%. Wow, that's amazing.
And they are not drinking today, by the way, and we've never charged them neither. And they never ever said anything bad to us neither. Well, because we've left it all with them to pick up the telephone and talk to us. Tell us that, you know, they're getting near to picking up a drink, or they might be relapsing, not a week later, you know, when it's too late. You know, tell us what's going on so we can get on top of it quickly.
Yeah.
So, you know, we actually make the calls ourselves to start with.
So you check in with them,
make sure they're okay, you know, just to get them into that part of, you know, and you know, once you've got a taste of sobriety, it is amazing as well, you know, when the light bulb comes on and you realise what this stuff's done to you and why it's done it to you.
Yeah.
You know, so we work in a very, very different way to other people work, you know.
Yeah.
We really do. And it's a bit like taking a driving lesson, I'll say. You know, if you take a driving lesson once a week, you'll pass your test in a few months or whatever. If you take 2 or 3 driving lessons a day, you pass your test in a week and you'll be a good driver. So it's the same kind of analysis, because this is all about thinking. It's all about our thinking and our thoughts.
Yes.
There's no, you know, injections here or magic pills to take. It's all about our thinking.
Yeah.
It's just wired wrong.
How open are they to the notion?
Sorry?
How open the clients to and their families to the notion it's all about the thinking?
Oh, they are when we get in there and we start working with them, and the family have already know that anyway, because the family will say, "Well, why are they doing this? We've told them that many times not to do this. We told them to do this. We told them to do that." But the person's not listening.
Yeah.
So they already know it's a thinking that's not straight, and it's ridiculous how it goes. I mean, I was, like I said, a millionaire at 30, so-called millionaire at 30, and a bankrupt at 46. So I wasn't unintelligent. I was very, very intelligent and employed a lot of people. But when it came to the alcohol and when it came to my thinking, it was my best thinking got me in trouble. Let's put it that way.
Your best thinking got you in trouble.
So I had to learn a different way of thinking, a different way of dealing with life on life terms without having to take a medicine of anything to do that.
That's interesting, because it often looks like, somebody calls it a misery stabilizer.
Well, look, everybody's walking around with a rucksack on their back.
Yeah.
Everybody. They're all walking around with this rucksack full of fear, full of worries from the past and everything. They've just carried it with them through relationships, through jobs, through whatever. Our job is to get that backpack off.
Yes.
Get it off. It's no longer. I always say to people, I don't want anybody rent free in my head anymore. Because I'm carrying all this stuff in my head, and so it doesn't belong there anymore. It's baggage from the past that doesn't belong there.
Absolutely.
And it was a revelation to me to think that I could let this go, that I could deal with the reasons why I've not seen my oldest daughter for 30 years. I could deal with the reason that I became the person I came and all the wrongs that I did. I could deal with it and put them to bed and sort of say, well, it's a bit of a Jekyll and Hyde, you see, this illness. You do become a different person.
Yeah.
I mean, I got well in 2006 after nearly dying. And if anybody asked me the question, I would tell them truthfully, Shig died that day. There's a different Shig today. He was born differently in 2006 because my whole outlook upon life is different. My whole outlook, the way I talk to people, the way I react with people, the way I care about people, the way I handle resentments, the way I handle disappointments,
So it's a huge mindset.
Yeah, and it's all learning. It's all learning. All the rest of the stuff, I'm the same. I'm still a dad. I'm still a son,
Yeah, of course. Yeah, there's lots of things to be the same, but it's your thinking that's changed.
I just don't have to run to a medicine of choice that I had every time I have a bit of fear in my life or anxiety or can't handle my life anymore.
Yeah.
And that's the thing here, and that's what you find with drugs and alcohol or any addiction, whether it be gambling, sex addiction, or whatever. It's
I can't.
It's a quick fix.
Yeah.
And what do we do to stop that quick fix? What do we do to alleviate that? What is it that we have to run to handle life on life terms? So it's learning to handle things, properly. Learning how to read your thoughts better,
How to read your thoughts.
Yeah, reading your thoughts is very important because a lot of the time with an addict's brain, it will tell you that you're rubbish, that you're a waste of space.
Oh, all of that.
It'll tell you all this, and you're reading into this, and and as an addict, that's what you do.
Believing it.
Our job is to say, don't believe that. It's rubbish.
Yes.
Learn to like yourself first and foremost. That's very, very important.
And imagine
every single client we go to don't like themselves. They've lost that ability to like themselves again. So our job is to make sure they get that back. Get to like yourself again. Get to love yourself again.
And that sounds like that's really critical. And by the end of the time that you spend in their home with them,
it's the amount of time we're spending. You can see. The trouble is, you see, this is why we don't like to structure it too much. There's a lot of programs, our 12-step program, SMART program. There's a lot of different programs out there which to teach people, about alcohol and drugs and how to handle life. But when you structure something, what I found when you structure something, if they've not picked up on what you've taught them, and they've just said yes and agreed with you, and then the following day you've moved on to something else, you've actually not covered anything. So we tend to go backwards and forwards, and we've got the time to do that because we're there for so many hours.
Yeah, of course.
When they start, the first thing they're suffering with is social anxiety disorders. They don't want to go out anymore. They don't want to face people anymore. They feel embarrassed going out. So we're getting them out and about, walking. We're getting them out and about, going for lunches. So we're doing the whole healing thing as we're going along. Very, very holistic. This is not an open heart surgery, that's for sure. But it's a painful experience as well.
Yeah,
it's a painful experience when you put that medicine of choice down.
Exactly, because you can't run to it anymore.
Yeah. And that's another thing we do. We try and do it naturally.
You try to,
and most of it, we do it naturally, which is slowing people down on the drinking, doing it in a safe manner, but doing it that way. I mean, there are people who have to go to rehabilitation centres. We have to, we've got a psychiatrist as well. If we have to medicate, there's some people who have seizures, some people just can't stop drinking, and they've need medical attention. But the kind of clients that we tend to attract are normally functioning people.
Okay.
Where we could slow them down on the drink of choice. Okay. Because they're used to going to work all day.
Right.
So there's a difference in clientele as well, isn't there? Okay. So depending on what kind of things we've picked up on, is how this is why our prices differ. Our prices are anywhere from £7,500 up to 20,000 plus.
Yeah.
And they differ because of that reason. We don't know what we're up against until we do an assessment. Yeah. In order to see exactly what we're fighting up against. What are we up against? People say, well, how much do you charge? What are you going to do? And I'll say, well, book an assessment.
Yeah.
You have to book an assessment, because at the assessment, we will tell you, exactly how long we're going to be there and what we think, you require and how much money it's going to cost you. But that's only because we spent 4 hours with you and your family going through your history and looking at every conceivable thing that we need to look at. Some people don't need law. Some people don't need business help, so we have to really see what we'll,
it's really tailored, isn't it? I mean,
very, very tailored to the individual. And some people don't need us at all, would you believe? We've done a few assessments where they actually don't need our service. They've jumped in too quickly, and there's not really a problem. It's not really something that needs our kind of service. Whereby then we can get one of our team members in just to do them a weekly session and let them have a weekly counselling. It helps them. So it's a matter of being ethical, to be honest with you.
It is. Yeah.
If they need it, we step in and do it. If they don't need it, be honest with them. And don't just take the money and just pretend that they're an alcoholic. That's not right.
Shig, shall we open up to questions now?
Go on, far away.
So I'm going to just stop the recording first of all.